So it's amazing how many patients I see who come in worried about one single thing. And I'll tell you what it is, their urine. People haven't kept a diary of what's going out of their body. They come to the clinic and you hear stuff like, doctors, I don't like the color of my urine. Now, what's it with the color of your urine? It's basically what you take in that you put out. Sometimes it looks a bit darker. I can get that. I can totally explain that if you're dehydrated. But people give me all sorts. They tell me their urine is lithium color. They tell me it's a bit brown. They tell me it's a bit too white for their liking. And then I start to try to differentiate what colors would match their situation. But again, beyond the color of the urine, I get people coming in, they want to talk about the smell of their urine. So the smell of everyone's urine is peculiar to them. Like if you're eating a lot of pineapples, your urine will definitely smell like pineapples. If you're eating a lot of garbage, it will smell like garbage. But beyond those stereotypes, some people have sweet smelling urine. You wonder what sweet smelling urine is, but the fruity smell, which again is a disease condition that if you do tell me that, we might have to do a bit more to find out why yours is like that.
Una go just a breakfast at. Una don't know who get PPO.
Most puzzling people are those who come in worried, really worried about the fact that their urine foams. Now this is something that I find a bit kind of, I don't know, maybe I should say it kind of worries me that adults don't know that if they concentrate, like we say in our place, and you come which clearly says that if you keep pointing the urine one place, one position, it's going to keep bubbling up because you're just building up some form of friction. But past that, when you get us a urine sample, there are a few things that we are mostly going to be doing with that. If you're female, clearly we want to be sure you're not pregnant if you're of childbearing age.
Does it concern you?
Then we do what we call a urine dip, which basically looks through the different indices. Obviously, we're looking at the possibility of an infection. We're looking at some stuff like the ketones, which may show if you're dehydrated or if you're diabetic. We're looking at the specific gravity, and then the bilirubin and the urobilinogens.
I have never heard the name of any thing like this one.
We're looking at all of this and then we'll match it to your situation. Obviously, a clinical examination will follow. But your urine is important. Don't take it for granted. My name is Dr. Jubira. I'm the GP. I've got a special interest in YouTube.
Maswala.